At Commure, we are trying to build the healthcare infrastructure of the future. We are dealing with a series of catalysts in healthcare. We have an aging physician population. We have doctors that are more overburdened than ever with the highest burnout rates than ever before. And we have patients that are getting sick at a higher rate. And on top of that, you have compression from insurance companies. Reimbursements are going down. There is an incredible amount of pressure being put on the healthcare system broadly. And so what we are trying to do is relieve that pressure with the most cutting edge tools in AI and bringing them to the physician, to the back office, to the front office in healthcare to alleviate that burden. At Commure, we really believe in using M&A as a powerful tool. Rockefeller did that with Standard Oil, and Standard Oil became a company that absolutely dominated in the oil industry. With M&A, you have to be thoughtful and careful about how you do integrations. At Commure, everyone has a very crystal understanding of our company's values and how we do things. And for us, speed is above all else. There are a lot of folks that say that, but we try to live that every single day. It is something that we are constantly pushing on. And so we're just very clear on what our values are and who we are as people. And as we integrate companies, exercise empathy, we want to understand what those companies have done well and what they need to improve on. But ultimately, at the end of the day, they are joining Commure and our mission and what we are trying to do in healthcare. And if you're on board with that vision, then we become stronger as a unit. Ultimately, that's the most important thing, and finding culture fits and people who are willing to take on the Commure ethos is super important and something that we're always very, very excited by. And so the companies that we have partnered with in the past year have been excellent mirrors of what the Commure ethos stands for. And we're proud to partner with all of them. Commure Nexus is such a special event because we get Commure's best and brightest builders. We get healthcare's best and brightest healthcare executives, and we bring them to one place. We are deeply collaborating with them. We are listening to the problems that these health execs are seeing day after day. And usually what we end up doing is the next 48 hours after this event, we go right into hackathons. We are building based on what we are listening from the customers. Speed above all else. We want to show them what you're saying is not falling on deaf ears. We are going to build solutions to provide value for you much faster than you could ever think. And I think that's such a special part about Nexus is the people here are the people that have the ability to actually make the change, to build the change and then to enact the change in the system itself. And that is an incredible group that you're putting together. A health system in healthcare, it is absolutely getting demolished by insurance companies. Insurance companies are jacking up the rules that they have. They're lowering rates at a never before seen level. Billing teams are the teams that should have the best engineers working for them. These people are the ones that are bearing some of the toughest burdens in healthcare, and they don't get the help that they need. We put engineers alongside these people in some of the darkest corners of healthcare and help actually build solutions to make their jobs easier and lighten the load, which ends up impacting health systems' bottom line. It ends up impacting retention for health systems. It ends up impacting the number of physicians that health systems can hire the next year. It ends up impacting patient care.